I'm Kristina with EveryStep. We are in Des Moines, our central office. I oversee maternal child health, home visiting. So there are nurses that go out within the 4 counties, Polk, Dallas, Warren, and Madison. And they see moms that are pregnant, they see moms postpartum, and then they see kiddos. We have 2 different programs. Some of the nurses on our team are under what's called a family partnership, and they are able to start seeing moms their first pregnancy only, but they get to stay with that mom and their kid for 2 years, so it's really close connection. And then our child health side can see moms at any point in pregnancy, whether they're due in a week or it's their 3rd kid, 5th kid, and are able to see them through postpartum and then for their kiddo. So recently, about a year, well, it's been a year now, I want to say recently because we're just kind of getting up and going, we thought, what a better way, we're seeing these moms, we're seeing these kids, to also start doing family planning, which is the Title X program. It's a national federal program, and basically it's for all of your family planning. It includes STD prevention, it includes breast cervical cancer prevention, some basic infertility help, and I'll get through all of that. So we're already seeing these moms, kids, what a better way, we're in the homes to start kind of talking birth control. We all know that hindrance of transportation, making it to doctor appointments, we're in the home, what better way than to go out and give a birth control right in the home. So, EveryStep's mission, we empower individuals, support families, and strengthen communities. So Title X family planning is the first in the nation. To bring family planning services to the actual participant's location of choice. Every other place in the nation does Title X in the doctor's office. So EveryStep is the first and only, and we got it approved with Medicaid and everything to actually be able to go into the homes. Or I have a client today that doesn't want me to come to her home, she wants to get on birth control without her partner knowing. She wants to meet at a library. Some of our nurses have met at McDonald's. We can meet these clients where they feel safe and where they feel comfortable, which is really cool. This is the only federal program dedicated to family planning and related preventative health services. It serves as a point of entry into care. Example, one of our clients is wanting birth control. She's in one of our child health and maternal programs, and she doesn't have a family doctor. So with getting her birth control, we're also getting her established now with a family doctor. So it's a great way to also get them into their healthcare providers. It is high quality, affordable, confidential family planning, and we obviously do give priority given to low income clients, but we don't turn anybody away for their income, for their insurance status, documentation, anything. Think about some employers do not let their insurance cover birth control. Think of some religious affiliated hospitals, for instance. Their health insurance doesn't even cover birth control. So they would be some of our clients that would come to us. Only care and support program that can provide services 100% confidential, even to adolescents, which was huge for me because at first, when I started this, I have public health background for Polk County, and I thought, well, if we do an HIV test for a minor, we have to tell their parents. Title X, you do not have to, which blew my mind. So even if a minor wanted to get tested for everything and their HIV did come back positive, Title X, if they are a Title X client, you cannot tell their parents. I would highly refer them and encourage them to an infectious disease doctor, Unity Point, or somewhere they felt comfortable with. Then they would be no longer considered a Title X patient at that hospital or clinic. And then if a minor, their results would go to their parents. But as Title X, it is 100% confidential. So Title X family planning, it does cover a wide range of education, counseling, access. So all Iowans of any age, they do need to be within childbearing. So if they've had a hysterectomy, they wouldn't be considered a Title X eligible patient anymore. You do have to be of childbearing. pregnancy diagnosis, all options counseling. Title 10 does not pay for abortions. Title 10 does not provide any type of like transportation or funding for abortions, but I can talk to my clients if that is an option that they are wanting. I can talk to them about where those options are located. I can give them education and guidance. Title 10 does not fund any of it. And that can change depending who's in office at any time. So it's kind of gone back and forth. Birth control medication, so pills, let's see, what we're offering everything right now. Our medical provider is Dr. Stacy New. She's at La Clinica, for East Family in Des Moines. She's amazing. She's, seeing clients in her, La Clinica has a lot of undocumented, low income, so she's referring patients. Seeing in a clinic side, she'll have an appointment, for like their next depot shot, and it's a no-show. They don't show up. She can call us, and I can send a nurse to that client's home, give them their depot, so they can stay on birth control and not have any unwanted pregnancies. Services for preconception health and achieving pregnancy, so it does include basic infertility, HIV testing, referral, testing and treating for STIs, screening for substance use disorder referrals. We also would do any depression screeners, anxiety screeners, Esper for anything cervical, breast, testicular, so that and then referrals to other health and social services, which is great because our nurses are well, rounded in all the community resources if they're needing help with, insurance. Actually, 2 of my Title 10 clients right now, they don't have insurance, but they kind of fell off in the Medicaid unwinding, so we're working with an EveryStep consultant to get them back on Medicaid.
I have a question.
Yeah.
I think it was just this week we were talking in a team meeting about Title 10 coverage for the PAP test.
Yes.
Is that something?
Yes,
Okay.
it would cover it. Yep.
So how do we refer a woman to you
Mhm.
who needs it?
Yep. So right now though, they would then go to Dr. New for that PAP test. Her or there's 2 other providers or any of the residents. And she would then be considered, we would go through eligibility. So even if they have insurance, we could do a sliding scale fee. Insurance is probably gonna cover it, Medicaid is gonna cover it. But say, we could do like what's out of pocket. What's nice with Title 10 too is like income. When we ask income, we don't have to verify it. I'm not gonna go out and search their pay stubs or track. We take their word for their income, and then they would fall on a sliding scale fee. Otherwise, it just gets billed to the Title 10 grant.
So an uninsured woman who is maybe not eligible for the Care for Yourself
Yeah.
program.
Yes. Yep. Yeah. Yep. It also covers, I don't know if there's a slide in later about vaccines, HPV vaccine, Hep B vaccine. It covers vaccinations as well. So family planning services are important. It improves birth outcomes and promote healthy families by assuring optimal pregnancy spacing, which is the recommended 18 to 24 months. It will help reduce the number of unintended pregnancies. It also increases screening, testing, referral, treatment of STIs. I was an STD nurse at Polk County Health, and oh my gosh, you can like track clients down to get in for their treatment and they don't show up, and then it's 2 weeks later, how many people have they exposed? If I can go out to their home and get them treated for gonorrhea, it is less likely that they're out exposing others. Improve overall health of men and women of reproductive age. Promote comprehensive primary health care services, and obviously providing them education and any medical or social services. So research suggests that beginning a pregnancy within 6 months of a live birth increases the risk of premature birth, the placenta partially or completely peeling away, the abruption, low birth weights, schizophrenia, congenital disorders, and then maternal anemia. So this is just really helpful. We're already out in the home for those postpartum visits. Why not say, hey, the big question with Title 10 is called the one key question, and it is, do you want to have a baby or get pregnant within the next year? If they say no, then we start start going through the options. It could just be timing, if the mother doesn't want to get on any type of birth control but just wants to do natural birth control. We have basal thermometers. We have, different ways to do that education. We offer the pill. We offer Depo. If they want an Nexplanon, we'll get them an appointment scheduled over at the La Clinica to get that placed. We're on Epic, their charting system every day, messaging back and forth. Hey, this client would be a great Title 10 client. Can you get her consents done? She wants a Nexplanon. Things like that. IUDs, everything. This just shows you the Title 10 Family Planning Services in Iowa. So we're right there in the CSA 8, Dallas, Polk, Madison, Warren. We have been partnering a lot with, just to learn, up in Blackhawk County. Is it? Yeah, so that's where, Allen College, we've been partnering a lot with Allen Women's Health. They have an awesome Title 10 program going there. This is also nice too. If somebody comes from a DARE, you can see down in the D area, they have, the closest one that they're gonna get to is probably in Polk. With Title 10, it doesn't matter where they live. Anybody can come to us. So if they're outside of our 4 counties, it doesn't matter. Anybody in the whole state can go anywhere they want for Title 10 family planning. This is our team. Dr. New is our medical director. Becky Borgman is our maternal child health director. Stephanie Burt, and these are your 3 nurses that will be actually out in the homes. Well, it's me right now. But Stephanie, Amanda, and Megan do our home visiting section, and they'll be the ones going out as well. Gina is great at getting anybody that needs insurance. So, and she's also bilingual Spanish, and she, I just send her an email and say, this mom doesn't have insurance. Can you call her and see what you can do for her? And then Claire is our outreach. Pretty good with doing outreach, and if there's events. I would love to do a pop-up birth control truck someday and just park it somewhere and people could just come up and get the birth control of their choice. So how it works, basically we will get a referral. So we've actually gotten tons of referral from Dallas County, which is awesome. I just was telling Abigail this morning, I was I keep getting 2 or 3 a day and it's just me right now, and I'm just okay, slow down a bit, but no, it's awesome. Then it will go to our intake team. And intake basically calls them and does the eligibility part and sees would they be eligible for it, which pretty much everybody is, as long as you're able to have a child. So that's the only stipulation. Then we can, if they do not want us to come out, they can do the state family planning partnership program, which is just a little bit different if they don't fall into Title 10, and then otherwise it's straight to our home visitation. So it would get sent to me. I'm going to assign a nurse within 24 hours. The nurse, these are just our rules, will contact that client within 48 hours. I try calling on the phone, I leave a voicemail, I'll text, and then the home visit completed. So, and then if referral is fee for services, I will call that client and give them an estimated cost ahead of time. So we wouldn't turn anybody away. So for example, we've had referrals so far from a school nurse in Des Moines, 16-year-old that was pregnant, didn't know what she wanted to do. I just saw a client last week. She's 16, has a 16-month-old, and wants birth control, doesn't want another child. And so I went out and met with her, and then I'm gonna go and give her a Depo shot in her home this afternoon. She doesn't have a car, so transportation's an issue for her, and she's a teenager. She also we know teenagers of compliancy, of going in and doing something, for themselves sometimes, especially with a 16-month-old. When I was in the home, mom lives with her, has a 3-month-old, and mom's I would like to get on birth control too. So it's just yes, like me and Becky say, we're gonna make it rain, birth control, and it's awesome.
I have a question. Can you meet with them in the schools as well?
Yes.
Okay.
Yep. Can meet them in the schools.
Have you encountered any school districts who say, you're not going to be in here?
Not yet. Not yet. I think Des Moines is probably pretty lenient more with that than maybe some of the others. But Yeah, no, not yet, and I know I was talking to my dad about all of this, and he's very, very conservative, and is, like, saying all this. I'm like, but Dad, he's like, how can they consent, blah, 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 without her parents, and he's just still so old school. I have to, like, reteach him everything to get with today's time. So what's included in a home visit? So I'll walk through. Last week when I met with my client, I, did all of her vitals, because birth control, obviously there's different ones for blood pressure, there's, weight, everything. So do a nursing assessment, and then I go over all the different birth control options. There's no coercing of like what kind they should do. I'm not gonna go into a home and be like, I want you to get an IUD, like this is best for you. It's totally up to the client. We do patch, the NuvaRing, there's pills, if they're breastfeeding, the mini pill. If they want something more lasting, like a Nexplanon or IUD, we would get them that appointment with Dr. New at her office. Birth control options, all options counseling, they're pregnant, they don't know what to do, adoption, key, if they would like options for abortion. STI testing and treatment, really cool. We will do everything. I can draw right in the home. I take like a nursing bag, I'll draw their labs. We do self-collection swabs and any of whatever kind of sexual practice they do, and then urine testing. Then we will take that back to Unity Point's lab. They send the labs out. I get the notification in Epic on results. I'll call patient. If they need treatment, I've already got AZIV, I've got Rocephin for gonorrhea, I've got all the STD treatment. Other than syphilis, we will refer to the health department or to a doctor's office, just because it's a little more of a strenuous treatment. Right now we're doing all of this through us and Unity Point. After we're up and running for like 6 months, the state will let us use their service, the CDSS service, so then that will be like all through the state. Basic infertility education, we would just refer them then to the clinic, usually for a doctor. Make sure they'll do blood work, make sure they're healthy, just kind of go through fertility. And then care coordination again for establishing, and then for annual exams and any IUDs. So this has all been possible or made possible because of this Unity Point clinic. We are able to, establish that care coordination. They do not need to change their PCP to participate in the program. We've ran into so far that most just don't have a PCP, so we've been able to refer them there, but they do not have to change it to participate in this. So when I go and see a client today, after this, I will see her, and if she wants to get on birth control, I can give her birth control for up to 3 months, basically. So if she wants the depot shot, I'll give her the depot shot today, and she's good for 3 months till I go back and give it again. If she wants pills, I'll give her 3 months worth. You just have to establish with the provider, Dr. New or somebody under her, all the residents, within 3 months. So then after I see her today, I'll send a message, so-and-so, date of birth, needs an appointment with you to establish Title 10 care. They can do it in person at La Clinica, or telehealth counts as well. So think of all of your neighboring. If I've got a mom in Winterset, she doesn't have to drive all the way to downtown Des Moines in 3 months to get that appointment. She can do it over telehealth, and I can come back out and give her medication, her birth control. We also, Title 10 can help pay for transportation. So if they really want to go and see her but don't have a way, Title 10 will cover the transportation, which is nice because our maternal child health we can't ever do that. Assist in financial coverage of appointment or requested medication. With STDs, I don't know if it's in here too, we can do expedited partner treatment as well. So if I go to the home, client tested positive for chlamydia, I'll give her or him a medication and for the number of partners that need it as well. There is a state family planning plan. This is eligible 12 through 54. So this is just a little bit different than Title 10. It's for Iowa residents, and they meet certain income limits. So women whose pregnancies and deliveries were covered by Medicaid will have family planning services covered for an additional 12 months without having their eligibility redetermined.
Kristen, is that 12 months beyond the current 60 days or beyond what's going
somebody wanting to talk to a mom of ours for all the drama going on with Medicaid postpartum. So interpretation services, this is pretty cool with EveryStep too. We have more than 27 languages in-house, so actual people that will come out with us and interpret for us, so we don't have to use like a language line. So we have 27 different languages within EveryStep that we utilize. So it's really helpful, and so we just schedule an appointment with one of our interpreters the same time and say, hey, meet me here at this client's home. That's a lot more personal and like enjoyable for the client to actually have someone than a phone for interpretation. So, any questions? Yes.
So I teach dual credit high schoolers in college, mainly in Carroll. Is there information that I can give them in class? Cause we'll be teaching healthcare section really quick.
Yeah. So about Title 10.
About Title 10 and the benefits that would be available to them
Yeah, I'll have
as
to.
Iowans.
Yes. So I would. Yeah. I'll get your email or do you send out like a post agenda with everything, and I can send out even like referral sheets, things like that, because